What folks were doing already was pooling or spending their money to help others, going around to homeless shelters and sharing this and telling people where there were resources and that you didn't need to suffer and you could get help. They did coat drives, backpack drives. So I'm talking at the very grassroots things to a woman who had started a not-for-profit because she lost her son to gun violence, to being able to take it to the next level and develop T-shirts and hold a gala. And now a street just got named after her son, all the way to a group of Mandarin-speaking women who pooled all their resources together, then engaged in their own fundraising efforts, were able to purchase a daycare franchise. So this way they could take their young children there.
And that story really gave me the goosebumps. Not only they're using this amount of cash to grow businesses, support their families, but also starting to give back to the community and make an impact. Welcome back to the Impact Collaborative podcast. I'm Dr. Claire Wang. I'm the Executive Director of the Impact Collaborative. And today we're joined by Traci Donnelly and Leon Greene. Traci is the founder and president of the Impact Collaborative, and she's also the CEO of the Child Center of New York. Leon is the Chief Strategy Officer at the Child Center. I'm really excited about the topic today because we're going to be talking about peer-driven change. And this program I love called the Cash+Community program. So Traci, let's start with you. Can you tell us about why and how you started the Cash+Community program and how does it work?
We started actually during COVID. We learned a lot from our line staff, as we always do. And on the ground, we were trying to do all the same things everybody does, right? Giving out protection, making sure people had face masks and hand sanitizer, giving out food boxes. And the staff was coming and saying what our people really need is cash. They need money because they need to be able to pay their bills and do things. So we were able to come up with what we called PEX cards, and they're basically like debit cards of which we could load with money. And we created like a matrix, a rubric as to who were the most needed, because we did not know where this money was going to come from, but we knew we needed to get it out to those that needed it the most quickly. And we distributed about $800,000 to folks within the community. And then we used that data after that. I had read a book called The Alternative by Mauricio Miller around peer-driven change. And we had always seen a beautiful sense of community within our communities that we serve. And I really felt like if we could just take what he wanted to do, marry it with what we were learning, we could create a program that was very specific for New York City, right? The peer-driven change group that we're part of is in 13 countries. We are the only one doing it in the United States, but New York City required a little bit of massaging. So we had enrolled about 30 cohorts. A cohort is about 10 folks in this, and we picked very specific geographic areas, right? So we had Far Rockaway because we had generational poverty. We're in about 5 housing projects there, and we saw a 3rd and 4th generation of single woman-led households. We went to Elmhurst and Corona, which was richly populated with new Americans. And then we are partners with 2 not-for-profits that are in Harlem. One is called GOSO and one is Custom Collaborative. GOSO provides services to 16 to 24-year-old youth coming out of being incarcerated, and Custom Collaborative does training for women living below the poverty level. So that collective gave us our 30 cohorts or 300 families that we then were able to enroll into the Cash+Community Works program. And we used a bit of a UBI model with distributing about $200 onto these PEX cards every month, but they were not handouts, and I needed to be really clear about that because there's something that most folks don't really understand or believe. Our folks don't want handouts. They actually want to be contributing members of society. They want to know that what they're doing adds value. So in exchange for collecting data, This was a pilot program, and we wanted to collect data on how it was working and what made it work. That's how we started with the basis of what this program was.
So much to unpack there. Um, Tracy, you mentioned about the UBI, the Universal Basic Income type of programs, and what sets Cash and Community apart is really that trust in the community to make the best decisions for themselves, trust the women, the families to make the best decisions for themselves. But also this community piece is very intentional in thinking about, because when we think about resources, it's not just monetary.
Correct.
Agency being one of them, the network, the support system being, something that we don't think about it too much. But Cash and Community is very intentional in building both. So how does this cohort idea work, and what are you observing in terms of you put these individuals and families together? Um, how is it going so far in that regard?
I mean, it's wonderful, really, because we had asked them to bring people they know, they get along with, they think they can actually work with. And you didn't have to be part of Child Center. That was the best part. You can bring some family members, you can bring friends from your community, whoever you thought you could work with to support each other. We wanted to create a support network and leave it to the folks. It was a privately raised money so we can do this the way we wanted to do it. And we also had only a director of the program and two what we would call community advocates or family advocates. And they were not allowed to intervene, give advice, or deliver services, which is really counterintuitive to what not-for-profits do. That was like a much heavier lift than it sounds. To tell people to do nothing, you would think it would be easy, but it wasn't. It's our instinct to want to help. And I would say if anybody helps or intervenes, you will not be able to work here because we need to trust that folks know what they're doing. And so the one way was, yes, that's giving out the money was part of it. But the most important part was collecting the information. And as we collected that information, we learned a lot, right? And but also the money stops about 18 months into a 3-year program. And that was because we wanted to see how those relationships took root. A lot of UBI programs, or when you hear about people starting small businesses, you hear about micro loans. What differentiated us as well was micro grants. So this meant you would not carry debt and you would have an opportunity to do exactly what you wanted to with this money. The same thing, no restrictions. I could have restricted anything I wanted on the card, but I trusted those we work alongside to co-create these solutions with us and to make decisions themselves. And they did, and they made good ones. And so we left it to them to sort of do that. And as I had mentioned, 2 sets of grants. One set was a wellness grant where you can write something up that you wanted to do, and it was up to $1,000. And the second was an impact grant, which was up to $5,000, and it meant you had to come up with a business plan. You had to be able to say that what you were doing was going to not only impact you, either you and your cohort or something in your communities, that more people would be positively impacted by your idea or your decision.
And I know we're going to come back to more details about how these impact grants really, the stories coming out of the recipients of these grants. But I wanted to unpack a little bit more about the data collection part of it. So I'm turning over to Leon. So I know there are a lot of measurements being done throughout the program. And so what are you seeing from the data?
So from the very beginning, we looked at just the environment of in the space of what are other projects asking, how are they evaluating the success of UBI projects, and so we started with a base set of metrics. So looking at income, looking at savings, looking at wellness, looking at business activity in the programs. So we had our base set of outcomes that we were looking to track, but we didn't want to just look at the hard numbers. We wanted to, yes, ask the hard numbers, but then get the narrative and the story behind all those numbers. So we set out from the beginning in giving folks a lot of freedom to really talk about their experience with the program, the struggles that they were having in their lives, and how they were working with others in the program, in their cohorts to work together to solve problems. And then as the program went on, it was a pilot program, so we really had the freedom to um, get that feedback from the participants and evolve the data that we were looking to ask. And some of the really interesting things we learned through that process is things like we were really interested in debt to income ratio and how that would evolve over time. But then as we worked with the participants, we really learned that the concept of debt was much more fluid for a lot of folks, and they really considered cash in, cash out type of bills, things like phone bills and gas for their car or their Metro card for the month. So we realized that some of our metrics we would not really have solid data from, but we learned a lot in terms of the story behind that data, and we were able to evolve how we ask throughout the process. And when we look at the end of the 18 months, and now we're in the second 18-month process, what we've been able to do is leverage the outcomes that we see in terms of the positive financial outcomes of an increase in average income, an increase in average savings, things like the food security that folks were feeling was our most statistically significant metric that we saw impacted by the program. And we were able to take those positive outcomes as well as the stories behind them and design a full research project that we are looking to get funded, that has a solid foundation in research principles, so we can take these wonderful narratives and what we learned from this pilot program and develop a full research study for that.
That is fascinating. And coming from a research background myself, I know that in research lingo, we said that this is called the mixed methods approach, right? Both quantitative and qualitative information gathering. So you can really have a full spectrum of the narrative of the program. And I'm so thrilled that you're able to collect your data and interpret the data and learn from the community in that way. And how thrilling that you're also embarking on a full-blown research study to really understand how it works and whether it works. Of course, we wanted to know whether it works, whether that it's making a difference, but also how it works and how does that impact people at the individual level. So, Traci, I think you started to allude to this. Based on the narratives that you're hearing, there are very rich information coming out of the participants. What are some of the stories that really resonates with you that you would like to share with the audience?
Oh God, I don't know. How much time do we have, right? I mean, this was just such an exciting program. And when I had mentioned that I read Mauricio's book, I was able to find him through LinkedIn, not like stalk him, even though it sounds a little bit like that. But we became friends, and we actually started talking all the time. And as we were evolving the program, we were talking about it. And he was a real mentor in helping me have, and the team really, in shaping the vision of why it's important to have storytelling and the narratives attached to the data, or it misses the whole point, right? And what we started seeing early on, pre-grant. So this is money you're getting your $200 a month, and what folks were doing already was pooling or spending their money to help others. That was the first thing that happened. We started seeing people building, creating flyers so they could start talking about destigmatizing mental health issues, going around to homeless shelters and sharing this and telling people where there were resources and that you didn't need to suffer and you could get help. They did coat drives, backpack drives for their communities, all the way. So I'm talking at the very grassroots things to a woman who had started a not-for-profit because she lost her son to gun violence, to being able to take it to the next level and develop T-shirts and hold a gala. And now a street just got named after her son just about a week ago, right? All the way to a group of Mandarin-speaking women who pooled all their resources together, their $5,000 of their impact, and they then engaged in their own fundraising efforts and were able to purchase a daycare franchise. So this way they can take their young children there. They own 20% of that franchise now, and they just cut the ribbon on that franchise, I think, about 2 weeks ago. So we're seeing folks either taking existing skill sets and passions, right? We want to have a passion. That's what you want for your kids. You want that in life. I mean, I don't have a job. I always tell people when they say, you work so much, I said, this is the equivalent to you playing golf, right? I love what I do. We have people now expanding what their passions are and contributing and creating, from making delicious foods, or we have folks that make piñatas. We have Custom Collaborative who are making green clothing, sustainable clothing lines, and using their skill sets and their passions to generate income for themselves and employ other people that they're friends with, but doing what they love, not just existing, but thriving and contributing back to society.
And that story really gave me the goosebumps, because $200 doesn't seem like a lot of money, but at the same time, these participants, many of them are women and head of the households. Not only they're using this amount of cash to grow businesses, support their families, but also starting to give back to the community and make an impact already. So I just love hearing about these individual stories. And in fact, I know that out there are a lot of criticisms and misconceptions about sort of these cash UBI kind of programs. Many people may say, well, you're giving away cash, and they might use it to, buy drugs and do things that is not good for the society. Leon, you have seen all the logs of how the cash was spent on and how they leverage this opportunity. Are you seeing any of that?
Absolutely not. We saw them using it on everyday needs. We saw them paying bills with it. We saw them buying groceries with it. We saw them using it in a way that is completely opposite of a lot of the naysayers of UBI. And so we go back to narratives and talking about the narratives, the stories they would tell about the impact just on their overall anxiety in a month. They know they can buy groceries. They can pay
Great
bills.
point.
They can buy a Metro card to get to work. And it's those basic needs that really drive your ability to tackle the day. And that was what the stories really focus on. And then the data that supported that.
Well, I can't wait to hear more about it. Before we conclude, Traci, what's next? Where are we expanding this program?
Yeah, well, actually, I'm really excited because we've had a lot of interest in the program. I mean, I think a really important point Leon just brought up was we use the data that from when we gave the money out in COVID to raise funds through private foundations. Because your point was such a good point in saying, did people spend it on illicit activities at all? And we were able, because this data I had printed and everything, and I was able to see exactly what they spent, where they spent it. And we use that to leverage funds. So now we have our second set of metrics and data to basically say, one of the big things is too, even folks that stop getting the money continue to meet. They've developed relationships. They asked to have a resource fair, which we had, so they could all meet each other from these different places in New York City and figure out ways of like, how can we share, no different than not-for-profits doing networking, right? So I'm so pleased with the types of outcomes that came peer-driven from them, their choices, their decisions, taking it to the next level and bringing others in now to create additional cohorts with no money at all. Just saying, you have to come in and try this and we'll support you. You can do your own businesses. So we're really seeing exactly what Mauricio had envisioned in the beginning. And I'm excited to now replicate it. People have been reading about it. They're interested. We have folks in Los Angeles now who are interested in piloting it and doing it here. So we're looking at a group for the street vendor group who already have sort of businesses that they can now expand on. We're meeting with some not-for-profits out here. Every time we talk about this program, there's someone else that wants to replicate it. And the beauty of it is you don't need to scale it with a prescriptive recipe, right? The community to which you're opening this in gets to drive the way you're going to go ahead and tweak it to fit the model exactly as you think it should be fit. So I'm super excited to continue to expand it, to work with folks that want to, and then continue to evolve our data. But our next big thing is getting it funded for the research project so that it's not that we think we know it's good or we're looking at anecdotal data. Now we want a real research program to stand behind it because we think this can drive policy and change the way we think about people living in poverty.
So, Leon, you talked about wanting to start a research project as we are expanding to the next phase. In terms of research design, in order to strengthen this evidence base, what's on your mind?
So after the original round, the pilot was over, we took some time to look at what we had, what were coming out of the narratives and the data. And we also, working with Dr. Rapp, we performed a number of focus groups to dig in further. And one of the overwhelming narratives coming out of it was the positive response to the peer support model that was present in the pilot program. And so we have a wonderful data scientist at the Child Center, Jeremy Marcus. He designed a 2x2 factorial study. So the idea is we feel like the secret sauce of our model that sets us apart from many other UBI models is it's not just a distribution of funds, but it's that peer support network that is encouraged through participating in the program. And so the model will have 4 separate groups, one that will receive both peer support and funding, one that will receive just funding, one that will receive just peer support, and then a control group. And so this is the basis of the research project that we are looking to start. And it will try to tell us, using some solid research foundations, the impact that specific peer support component on UBI as a concept going forward, and hopefully can inform future versions and future models going forward.
Oh, that is wonderful. And so you're really using vigorous research design so you can really show that whether the secret sauce is the secret sauce that is not just one of the components, but it's really the synergy of the two things that's making a difference. Wonderful. I think that's very smart to really strengthen the evidence base. We're moving forward to expand this program. Well, thank you for taking the time today to join us and share about Cash and Community. More to come.
Thank you so much. Appreciate it.